na niya na manghihimasok ako dyan pag hindi niyo sinolusyonan, yun ang masarap bantayan kasi baka naman siya ang mag-violate ng Constitution in the process, di ba? Paano nang himasok ang presidente dyan? Di ba? Paano ka pa manghihimasok doon? Hindi naman, technically, di ba? Hindi ka dapat makialam doon, di ba? Power of the purse nila yun
Pero dalawa yun, di ba? I mean, yun naman yun natin. Can you parse that? Because on the one hand, wag niyo ako idamay. Sabi niya.
He said it twice.
But that's specific to the fight for the speakership. You would assume. Diba? On the other hand, ito nga, parang, diba, kung hindi nyo ayusin yan, papasok ako dyan.
Yeah.
Although mahirap sabihin na huwag niyo ako damay when from the start, siya yung nag-broker agreement.
Well, yeah.
Mahirap.
Some bits and pieces of information to put context into what happened kanina. Diba? So, there. Interesting night. Should we go back to more urgent issues? Of course, kasi wala pang segue queen natin, so I'll do the segue na. We of course, when you say urgent issues, we're also talking about we're still talking about COVID-19 and the possibility of having a vaccine sooner than we earlier thought. Actually, pabago-bago eh. So for our first guest tonight, we are bringing him in right now. We have Dr. Jaime Montoya, the executive director of the Philippine Council for Health Research and Development. Dr. Montoya, good evening po and welcome to the Chiefs.
Good evening po, Dr. Montoya.
Yes. Good evening
Hi,
po.
Sir. Hi, sir. Thank you for joining us po. Well, sir, we'll start off with that. Yung sinabi po ng WHO there appears to be a big possibility that by the end of the year, we have a vaccine. Is this a new development or is this, kasi nga, we've been talking about hopefully by December, but at the same time, we've also been hearing na baka next year pa ang vaccine. So are things changing? Is the timeline changing?
Actually, what the Director General of WHO mentioned is really what we expect. Kasi po, if you will look at the rate, the progression of the phase 3 clinical trials in different parts of the world, in the US, in China, in England, you can very well see that they started early, around August or early September, and you count 3 to 6 months from then. That will basically finish, barring any problems, November or late November or early December. If that happens and the data is good and they're able to do the analysis fast, they can have it approved by their respective FDAs in their home country. But you have to understand that, for example, for the Philippines, it will take time for that to happen because before that can happen in the Philippines, we have to wait for the approval in the home country, their home country, and then we give it about 1 month for them to send over the information and maybe for the FDA to also do the appropriate analysis. So it will really be, maybe you can push it to the latter part of first quarter, but really that is, I think, really wishful. I would consider some kind of wishful thinking.
So yung local,
more realistic. For the Philippines, it will really be second quarter of next year.
So yung local approval po is talagang a different, it's a different layer altogether from dun sa
the earliest
approval.
Because you can imagine the supply. I mean, even if it becomes available in the US, it will be available in the US, not immediately in other countries, because there's so many countries that are actually lining up. And we are part of the COVAX facility, which is an advantage actually. But COVAX, the COVAX facility that we are part of, can only provide the vaccines based on their timelines at the earliest, the early part of second quarter of next year. So it's still consistent with what we are projecting in terms of availability of vaccines here in the country.
But I understand that the objective of COVAX is precisely to distribute to all the world, no, especially the poor countries.
Yes.
But really, how feasible will it be for a country like ours, diba, to get the vaccine as soon as clinical trials are done and FDAs of home countries have approved the vaccine? For example, if it's the US that first approves it, realistically, under the COVAX facility deal or goals, no, how soon can we expect to get the vaccine in commercial quantities?
Yeah. Assuming that the approvals will happen within the year. For example, the US FDA will approve their local vaccine. I mean, the vaccine that will be, of course, for the world, but initially for the US, within the year. The COVAX facility has to set aside the vaccine supply for that particular vaccine that will be allocated to the countries that are part of the COVAX facility. One guarantee that we have as being part of the COVAX facility is we can access at least 20% of our national demand. So if you're a population, or let us say we want to vaccinate everyone, let's just for easy computation, 100 million population.
Yes.
We're talking about 20% of that. That will be about 20 million. Yes. And that will be for healthcare workers for the first 3% of that 20%. And then the remaining 17% will be for the other high-risk groups, the elderly, people with other illnesses, etc.
Okay, and what will be the impact of that? What will be the impact of that if 20% of the population is vaccinated? I mean, is that enough to actually control the spread? Will it slow it down, and by how much? Yeah.
Well, it is not enough to control the transmission, but it will be able to limit or control the transmission among the high-risk groups, the people who are most at risk and who perform critical functions that will be affected if they get sick. That is why healthcare workers, frontliners, social workers, for example, teachers, are classified under this group. People who work with communities as part of their work or job, definitely they will be part of the priority. And definitely the COVAX is already allocating that amount for the countries that have access to the COVAX facility. So that's for sure. But for the remaining 80%, that is subject to negotiation. So we have to negotiate either to the COVAX as well, or maybe independently to the companies separately or individually. No. Let me also add that there is also an express lane for approvals in the FDA in the Philippines. They can make use of what we call emergency use listing, no, EUL, which is allowed by national regulatory authorities, especially if they're already approved by the developed national regulatory agencies like the US, Europe. They can be given an EUL, which means mas mabilis po yun. But it will be used only for a part of the population, like healthcare workers, for the time being.
But Doc, just to put that on record para po malinaw, since nabanggit nyo, is it safe to assume na ito po i-apply sa EUL ba?
Well, that is the option of the national regulatory agencies. There are two mechanisms actually that are allowed. We have what we call pre-qualification by WHO. What does that mean? It means that for those who are successful with very good results based on phase 3 clinicals, after they are approved by their FDAs, will undergo a pre-qualification evaluation by WHO. It's like a guarantee or a seal of approval of WHO. And when that happens, then governments can readily access, shorten the review process by their FDA. That's one option. The other option is what we call the EUL, which I mentioned, the emergency use listing, wherein the NRA will still review, but because it's already approved by the developed countries, it can have a shorter review process.
Yes, sir. But either of these two options po will be the prerogative of the executive and the regulatory bodies. Hindi ito kailangan magdaan to any other branch of government.
Yes, it is the primary function of the FDA. FDA is actually the gatekeeper. It will be the one to determine what vaccines will be made available in the country. The government, of course, FDA is part of government, but the rest of government, like the DOH, will have to decide which of these vaccines that are approved by the FDA will be bought to be made available to the public, like the poor, who are vulnerable groups in the country.
Okay, we're talking about the budget now, of course, in Congress, no, and has enough been allocated to make sure at least that a considerable portion of the population will be vaccinated by, let's just say, end of next year?
I would think that the plans are being made. Unfortunately, I cannot comment on that because there is a sub-technical working group on procurement, on vaccine procurement, that is in charge of that, and it's actually chaired or co-chaired by the Department of Budget and Management and the Department of Health. So they will be in the best position to answer your question. But I'm very well aware that discussions are now going on to make sure that we've allocated enough budget to cover at least the minimum coverage for the population. And if I can mention,
which is what?
Yeah, well, alam nyo, there are varying figures, but siguro I can just quote from what is available in the literature. About 50 to 60% of the population should have immunity, either by natural infection, meaning they recovered from a natural infection, or by vaccination, in order to produce what we call herd immunity. Now, herd immunity is a phenomenon wherein it tells you how much of the population should be immune for transmission of the virus to slow down. To be within manageable levels. And based on the literature, it's anywhere from a low of 50% to a high of 70%. We really don't know what is the herd immunity for COVID-19 vaccine, because it's the first time on our experience with vaccines in the past. It will be anywhere from 50 to 70% or 80%.
Sir, let me see if I'm getting this right. Do you mean by that you don't need to vaccinate 30 to 50% of the population anymore because of herd immunity? You only have to vaccinate 50 to 70%?
No. What I'm saying is that's the minimum. No. Let me clarify. That is the minimum that should be vaccinated to slow down the transmission. Okay. But for you to actually, all of us would like to have eradication, meaning for it to disappear. I mean, even if it's very difficult, you can only achieve that if you're able to vaccinate all of the population.
Okay.
So that is just the minimum.
Sir, pwede kaya yung mga private health institutions to order their own vaccines? Or will everything be supplied by...
Of course.
Okay. It will be made available.
Yeah, it's not just government is going to buy. Remember, the FDA will approve, and once it is approved, it is now available in the market. So anyone can buy. I mean, if you have the money, you buy from out of your pocket. If not, you depend on government. The public sector will provide. So for as long as it's approved by the FDA, it is already available for use by anyone.
But it will not be required. It's not going to be required. Di katulad ng mga sa infants, di ba? They're required to have measles and diphtheria and all these other basic immunizations.
That's a very good question. But I will defer to the DOH and to the leadership to determine whether we need to issue a national policy with regards to vaccination. Because, one very basic important concept about vaccination and benefiting from vaccination is there's a short quotation that I would like to share with you, repeatedly mentioned by all of the experts and even by the UN Secretary General Guterres and the WHO Director General. No one is safe until everyone is safe. No one is protected until everyone is protected. In other words, if there are people who refuse to be vaccinated or protected and they're susceptible, then all of us will still be at risk. That's what we're trying to say. So I cannot assume or presume, but maybe the Department of Health, we have to discuss that, whether there's a need for that policy to be issued.
Sir, may pahabol lang akong tanong. It may sound funny, pero I ask this in all seriousness. Kasi kanina you're talking about mother countries developing vaccines, and we may approve these vaccines later on pa using our own local regulatory process. Syempre. For example, China. China's already trying to develop its own vaccine. But you're also looking at a globalized online marketplace. You have goods from China coming in after ordering in a week. And we've seen cases nga na some supplements and some so-called drugs are being sold, for example, Lazada. So is there a chance, or how will it be regulated, that people would buy vaccines developed by China once they are approved in China and get them here long before the FDA approves them?
Well, you know, those are possibilities, but I think as far as the Philippines is concerned, we have to make sure that the products that we're going to use or the vaccines that we're going to benefit from or have access to are really the ones approved by the FDA. Let's bear in mind that the FDA will be in the best position to determine whether this vaccine that supposedly works in other countries will also work in the Philippines. And that is part of their decision-making process. They have to determine that, in fact, these are safe and effective vaccines that will be made available to the public in the Philippines.
Well, yun nga po, I asked it kasi there are some there have been some drugs that are being sold online and being imported from China.
Yeah, I mean, if for example, for the sake of argument, it's available in the US, you go to the US, you can be vaccinated. You come back here, you're vaccinated. That's up to you. But what we're saying is that as far as the Philippines is concerned, the product or the vaccine should be approved by the FDA first before anyone can use it.
Sir, going back to the COVAX facility lang, no? So you're saying that yung 20% na allocation, lahat na ng vaccines yon na available, whether it's from Germany or from the UK or from China, or lahat na yon, 20% of those vaccines. Ganun ba yon, sir?
Yeah. What we're assured of is that we're going to get 20% of our demand, but there's no mention of whether this will be just one vaccine or several vaccines.
Oh,
but
I see.
The one sure thing there is that only the successful vaccines with good results from their phase 3 clinical trials that have been prior approved and proven to be safe and effective will be included in the ones that will be distributed to the countries accessing the COVAX facility.
Okay. All right.
Okay. So hindi aggregate na 20%, 20% kasi if they approve 5 vaccines, 100% tayo.
Oo nga, yun nga nasa isip ko eh. Para pa-order po
I think you would agree with me when I say that I think it's impossible that just one vaccine will be available for all.
Oh yeah.
Because there's not enough supply. I think it will be different vaccines that are safe and effective that will be available.
Okay. Dr. Jaime Montoya, Director of the Philippine Council for Health Research and Development. Doc, maraming salamat po for joining us tonight.
Thank you, Doc.
Very much.
Okay, and now we bring in Science and Technology Secretary Fortunato de la Peña, who agreed to join us tonight. Secretary de la Peña, there's Ami Paminton of Philippine Star. You're just in time for Secretary de la Peña, who's coming online just about now. Secretary de la Peña, sir, thank you for joining us.
Good evening. Magandang gabi sa ating mga kasabay.
Yes, sir. Sir, Let me ask you first about there was a question being raised by Senator Tolentino. Apparently, meron daw confusion dun sa overlapping functions ng DOST, DOH at ng FDA with regard to COVID-19, and he's worried that once a vaccine is approved or comes in, magkakagulo-gulo yung mga functions and responsibilities ng tatlong ahensya. Kayo po, from the DOST's point of view, is it clear? And what is the DOST in the whole formula?
Nililinaw nga namin, mag-i-issue kami ng statement kasi napakaliwanag naman ang hati ng trabaho namin. Ano? Ang DOST ay na-involve as a research and development group. At nung itayo yung sub-technical working group on vaccine development, ay ginawang chair ang DOST, co-chair ang DOH, at yun namang sub-technical working group na yun, magkakasama din doon. Membro din ang mga undersecretary sa DOH, ang FDA Director General, meron din kaming kasama mga taga-FDA kasi yung pakikipag-collaborate o pag-negotiate sa mga ibang bansa ay kailangan din sila. At pero katulad na sinabi ni Dr. Montoya kanina, isa lang ang gatekeeper kung ang vaccine ba ay tuloy na ang trial at kung ang vaccine ba ay okay na para gamitin. Magkaiba yun, ano, na yung pag-o-okay sa trial, iba pa rin yung pag-o-okay sa paggamit. Ngayon, siyempre, ang DOH ang mag-decide ultimately kung aling bakuna. Kung halimbawa, kung maraming bakuna ang pumasa sa FDA, ay siyempre, ultimately ang DOH din ang nakakaalam kung alin doon at kung ilan ang o-orderin. At kaya nagkaroon naman ng bagong sub-technical working group sa procurement na pinangungunahan naman ng DBM. Pero napakaliwanag ng proseso. Halimbawa, kung merong isang kumpanya abroad, halimbawa yung Gemalaya, yung sa Russia, gusto nilang introduce yung produkto nila dito, nag-usap at pumayag man sila na ibigay yung kanilang datos para suriin ang ating vaccine expert panel. So yung sub-technical working group na pinamumunuan ng DOST, ang nangangasiwa noon, kami ang nag-create ng vaccine expert panel at kung pumayag at pumirma doon sa confidentiality disclosure agreement, ay magsisimula silang magpadala ng data nila doon sa mga natapos na trials sa kanilang bansa. At yun naman ay susuriin ng ating vaccine expert panel hanggang hindi sila nasisiyahan ay hindi pabalik-balik yun. Sinabi ng vaccine expert panel, kulang pa itong data na to. So sasagot sila, gano'n, ano? At pagka nasiyahan ang ating vaccine expert panel sa datos na kanilang sinuri, meron pa isang proseso na kailangan pwede namang gawing in parallel yung tinatawag na evaluation ng ating ethics committee. At usually naman yan, ang isang basic requirement yan, yung tinatawag na document of informed consent. Yung gagamiting document para doon sa mga volunteers. Kasi doon makikita kung protektado yung ating mga volunteers. Once meron na nung clearance from ating ethics committee at meron na ring nasiyahan na rin ang ating vaccine expert panel, ipo-forward na yan sa FDA. At FDA ang magsasabi kung masuri nila yan, okay, pwede na kayo magsimula ng trials. Pagkatapos ng trials, yung resulta, isasubmit muli sa FDA, sila na naman ang magsusuri para sabihin, okay, pwede nang gamitin yan. So, napakaliwanag naman ang hati ng trabaho. Kung siguro nakikinig lang sa ating kamukha nito, maintindihan na.
Secretary, yung vaccine expert panel nyo, since you are the scientist, kayo din siguro ang tatanungin dahil sa ngayon we are pretty sure na magkakaroon na ng vaccine, ano? Pero lahat ng tao nag-aalala. Is there really enough time to test a vaccine properly anywhere in the world? Lalong-lalo na sa Pilipinas, napakalaki ng concern because of what happened to Dengvaxia. So kung i-roll out yan, let's say mga second quarter of next year, dito, mass distribution, tatanungin kayo, matatakot yung mga tao, naku, ayoko mauna dyan, ayoko mauna. Pag tinanong yung vaccine expert panel nyo, you, the scientists, from a scientific viewpoint, ano po yung sasabihin nyo sa mga tao? Para sige na vaccinate na kayo.
Unang-una po, hindi i-endorse sa ating FDA yung bakuna na yon after the halimbawa nag-clinical trial na, hindi naman sasabihin ng FDA na approve na yan kung hindi sila nakakasiguro sa safety at saka sa efficacy. Merong siyempreng standard na sinusunod sa efficacy, kung ilang porsyento ang efficacy or effectiveness. Meron silang minimum dyan. Ang pagkakaalam ko, at least kailangan merong 50% efficacy para payagang makagamit. Yung safety naman na yan, usually nag-umpisa na yan doon pa lang sa phase 1, sa phase 2. Kaya nga sinusubok muna sa hayop, tapos sinusubok sa mas maliit na sample ng mga tao, tapos lalaki pa ng konti yung sample, yun na yung phase 2A, phase 2B, bago pa magkaroon ng malawakang trials doon sa phase 3. At sa phase 3 naman, nakaabang dyan. Kaya tayo merong data monitoring committee dahil isusubaybayan ang bawat isang makatanggap niyan para masiguro na siya ay maalagaan kung ano man ang kung sumakit man ang kanyang braso sa bakuna o kung nilagnat siya sa bakuna, ay kailangang ma-monitor yan. Kaya hindi po pwedeng yung magbo-volunteer na bakuna transient lang sa isang lugar, kasi kung siya ay umalis na after so many months, hindi matatapos yung monitoring kasi kailangan mahaba din yung monitoring. Kahit yan ay ginagamit na, ay meron pa ring monitoring na ginagawa. Kung minsan nga natutuwa din ako kasi kung minsan may mga nagtatanong, pwede naman kami mag-volunteer, ano? Kabaligtaran nung sinasabi ng iba na baka matakot. Siguro dahil gustuhan nilang magkaroon na ng immunity, yung iba ay nagtatanong, pwede na ba kami mag-volunteer? Ano? So magkakaiba naman ang ating pananaw.
Pero Sec, speaking of doon sa mga natatakot, and we sort of touched on this a little bit kanina kay Dr. Montoya. And that brings up the question of, as we know, even prior to COVID, mayroong may hopefully kaunti lang, pero meron talaga mga anti-vaxxers na tinatawag. Now, given the situation and given the impact of that COVID has had, and given the need to develop, as we said, herd immunity, and for as many people as possible to be vaccinated, what would be the recommendation with regards to making this voluntary or mandated for the people once it is available for vaccination for everyone?
Oo, kasi nga naman meron tayong pagkakahati-hati ng trabaho. Hindi naman namin pangungunahan ang DOH diyan, ano, at kami ay doon sa trial in charge, ano. Pero gaya ng sinabi ni Dr. Montoya, mas maganda kung lahat ay mapabakunahan. So siguro naman gagamitin nila yung kanilang judgment kung ano ang mabuting policy.
Pero from a science point of view, no, meron na po bang vaccine or even medicine, no, na lumalabas nga lang yung side effects years after? And on the basis of that, can we be assured nga that a vaccine for COVID, which is being rushed and which presumably will only have been tested for a couple of months, will not have any long-term side effects? How can we be assured of that? Has there been a precedent, for example?
Yung sinasabi ninyong nirarush, hindi naman ibig sabihin na kahit na hindi pa nasasatisfy yung bilang ng mga taong susubukan, gagamitin na. Ano? Kaya kamukha ng WHO Solidarity Trials, ang kainaman yan ay sabay-sabay. Halimbawa, ang 100 bansa na magta-trial, so ang laki agad ng iyong population na pagbabasihan. Ano? Kaya nga kami, priority namin yung WHO Solidarity Trials. Pero dun sa, ano nga yung unang tanong?
Yung long-term effect po. Meron bang precedent? Meron na bang vaccine na medyo maiksi lang yung study or clinical trial period at nalaman nga na 10 years down the road, meron palang effect sa health ng mga nag-try ng vaccine?
Hindi ko alam kung ano diferensya ng maigsi at saka mahaba. Ang importante kasi ay masubukan yung bilang na tinatarget. Kung 1,000 ang target natin, ay yun ang pagbabasihan. Kung makabuo tayo ng 1,000 ng mabilis. Ano? Kung matagal, hihintayin natin yun. Hindi natin mamadaliin. Katulad din ng ginagawa namin sa mga clinical trials din sa mga natural products, ay hindi mo naman pwedeng madaliin kung ang nagbo-volunteer lang ay ganito kadami. So hihintay-hintayin mo na mabuo mo yung sample. Kaya sa akin, hindi ko iniisip yung minamadali ang vaccine. Siguro minadali nila yung pagde-develop. Pero yung trials, sa tingin ko, hindi pagmamadali ang word na ginagamit. Kung hindi, gusto nating makuha talaga yung target na susubukan ng bakuna. Kung makikinig ka dun sa mga espesyalista sa mga ano tawag dito sa immunization, katulad ni Dr. Lulu Bravo, na emeritus professor sa UP, siya ang nangunguna diyan. Sabi nila sa 30 taon nilang eksperyensya dito ay wala pa silang na-experience na yung ginawang vaccine trials ay nagresulta sa masamang resulta sa mga tao. So dahil talagang ginagamit din nila yung safety precautions kung sino lang ang pwedeng tatanggapin. Hindi po pwedeng nag-volunteer ka, tanggap ka na. Ang daming screening process. Yun nga lang pag i-screen namin sa Lagundi, maraming may gusto pero hindi naman lahat po pwede. Unang-una, titingnan yung iyong edad, titingnan kung may sakit ka, titingnan kung ano yung mga level sa dugo mo na pasihan kung ikaw ay risky na gamiting volunteer o hindi. At pagkatapos noon, talagang sinusubaybayan pa. Kamukha na lang sa virgin coconut oil na wala tayong alam na harmful effects, minamonitor pa rin niya kahit na nga yung halimbawa yung aming 56 volunteer sa 57 sa Santa Rosa, 56 ang requirements, nakauwi na, 6 na lang ang natitira sa Santa Rosa dahil nakauwi ng lahat. Pero sinusubaybayan rin sila hanggang matapos yung 28 days na pagbibigay sa kanila ng virgin coconut oil. So hindi talaga minamadali.
Pero kasi po yung in previous phase 3 clinical trials, they would take years talaga to test so many people. Of course, we all agree on the urgency of the matter. I think lang the point of Luci's question is, wouldn't it be possible that there are certain variables that have not been looked into because we are looking at only a few months of testing, and so some side effects could come out after so many years.
Hindi pwedeng may mami-miss kasi yun ang dahilan kaya tayo may mga vaccine experts, Kaya nila hinihimay na mabuti yan, Kahit na itong mga 6 na pumirma ng confidentiality data agreement, 3 na yung nagsimulang magbigay ng datos, yan hanggang hindi nasisiyahan sila doon sa nakita nilang datos ninyo, pabalik-balik. Kaya kung minsan napapagalitan o nasisisi kami, bakit daw ang tagal nung proseso ng pagbibigay ng clearance para i-endorse sa FDA. Hindi mo mamamadali yon hanggang hindi nakikitang sapat na maganda ang resulta ng trial.
I mean, Doc, Secretary, yung isa pong parating, historically, and many times you've been here, it's always brought up as one of the most notorious incidents of side effects coming out years later, thalidomide, diba? But in this case, and since then, how do you, for example, for the particular sector of women na buntis at mga anak, diba? Obviously, there are protocols separate for them. But ultimately, how do you test whether or not there is going to be side effects for pregnant women, for example?
Ay sana tinanong na nyo kay Dr. Montoya yan kanina. Inuulit-ulit ko, professor of engineering ako, kaya hindi ko alam lahat yan. Dapat tinanong na kay Dr. Montoya, professor of infectious diseases.
Sige. Yes, sir. You're excused.
Kasi pagka ikaw naman kasi na-assign sa science and technology, napakalawak ng fields. Pwede
understand.
engineering. Nagkataon ngayon, talaga hit na hit ang health. Oo.
Yes, sir. Yes, sir. Certainly we understand. I think naman you get our drift that of course there are some concerns and understandably it is a very urgent situation and there is really need to rush it. Siyempre, in the end people will also be looking at so many years down the line and what could come up unexpectedly. But anyway po, maraming salamat po si Secretary Fortunato de la Peña ng Department of Science and Technology. Sir, thank you po for joining us.
Nagpapasalamat ako kasi halimbawa yung mga comment nung kamukha nung binigay ni Senator Tolentino. Nakikinig lang sa inyo, di sana nalilinawan at wala naman kaming confusion ng DOH at FDA kasi lahat halos naman ng meeting kami pa rin ang magkakasama. So nagkaiba-iba lang ng chair pero yun din at iba lang ang merong main responsibility dun sa isang grupo siyempre at ginagalang natin kung ano yung mandato ng organization. So kagandahan nito, meron na kaming napag-umpisahan dahil ang DOH at DOST kasama ang UP National Institutes of Health at kasama din ang CHED ay ang 4 na ahensya na itinakda ng National Unified UNURA, National Unified Health Research Agenda. Batas yun na hindi kami gagawa ng research hanggang hindi nag-agree yung 4 doon sa field ng health. At ang kagandahan naman sa DOH, kung nga nire-recognize nila yung aming coordinative role, pati yung kanilang budget for research, parang bahala kayong mamahala nito. Ginagalang nila yung desisyon namin para dyan sa paggamit ng research funds.
All right.
Okay. Secretary, thank you po for joining us.
Salamat.
Stay safe po.
Salamat, sir.
Salamat po.
I look forward to your interviews kasi naiintindihan nyo ang mga limitations. Salamat po.
Thank you, sir.
Okay.
Just going to gap, so please stay with us.
Welcome back to the Chiefs. We're now in the final stage of our conversation. And now joining us is Cavite 4th District Representative Elpidio Barzaga. Good evening, Congressman Barzaga.
Good evening. Magandang gabi.
Magandang gabi po.
Welcome po to the Chiefs. Sa start po na itong show kanina, nabanggit na nila Lucci na yun nga yung istorya ngayong gabi, yung announcement ni Presidente about the budget. At kaya nga na-late din ako dahil hinabol namin yung story. Sabi ni Presidente, kung hindi daw ayusin ng Kongreso yung budget row, he will step in and do it himself. Ano po bang pwedeng gawin ngayon ng House?
Well, unang-una, tapos na ang second reading. At traditionally, ang ginagawa talaga ng House, pag period of amendment, nagka-create kami ng small committee to consider all the proposed amendments ng mga kasapi ng Kongreso at kung ano man ang napagkasunduan, it will be ratified or approved by the majority of the members of the House sa kasusunod ang third and final reading. So yun ang status ng budget deliberation insofar as the House is concerned. Kaya nga lamang ang kaban ng ating mga kababayan, lagi nilang naririnig na baka magkaroon tayo ng reenacted budget coming from some of the legislators. Nais kong ipaalala na kung magkakaroon tayo ng reenacted budget, ang gagamitin nating budget ay yung 2020. At noong ginawa namin yung budget ng 2020, wala pang pandemic doon. And therefore, there is no provision in the 2020 na i-address ang pandemic problem in the country. And that is the reason why we have to approve the budget on time. And the President cannot afford to have a reenacted budget. Sabi nga niya, paano yung mga nasa ospital? Paano yung mga kailangan nating testing facilities? Paano yung vaccination? Kung ang gagamitin natin reenacted budget, this is one thing which we cannot do. At pangalawa, meron pa tayong halalan sa May 2022. Yung halalan sa May 2022, marami ng mga bidding dyan na ginagawa during 2021.
Opo. Well, Congressman, I think we all agree po. We agree po.
Yeah, Congressman, doon po sa sense of urgency and yung importance nitong budget na to, I think malinaw po sa lahat. But what I'd like to get to is the process, because ito po yung quote kasi ng presidente. Sabi niya, you resolve the impasse, and he said, pass the budget legally and constitutionally. Why did the president say that? I mean, will you acknowledge that the president is basically suggesting that there is something illegal or unconstitutional with the process so far?
Well, I think the apprehension of the president is that yung naririnig sa mga legislators, most especially our senators, na wag nyo kaming sisihin kung hindi namin ma-aproban ang budget on time and we shall be having reenacted budget. The president cannot afford that. And that is the reason why he is saying that you pass the budget, otherwise I'll be the one handling the problem, I'll be the one passing the budget.
Yes, sir. Yes, sir. But specifically po, sinabi ng Pangulo, I will not cite the constitutional provision that you violated. So he's implying that there was one party that violated the Constitution in the last so many days of the events in Congress. Now, I asked about that kasi there have been some people saying that there was a violation of Section 16, Article 6 of the Constitution when the House adjourned nung Tuesday instead of adjourning ng August 16.
October.
October 16. Sorry. The Constitution, the provision says that neither house shall, without consent of the other, adjourn for more than 3 days. That's been cited po. Could that possibly be what the president is referring to?
Well, actually, as a lawyer, and even law students know that provisions in the Constitution may be directive or it may be permissive or mandatory. At yung sinasabi ng adjournment ng not less than 3 days, we consider it as merely as a permissive provision in the Constitution. Katulad sa saligang batas nakalagay, right, ang pinag-uusapan natin budget. Under the Constitution, the appropriation bill shall originate from the House of the Representatives. And the Senate may propose any amendment or concur with the amendments only once the House has approved on third and final reading the bill and the same is transmitted. Yan ang provision ng saligang. Conduct sila ng budget deliberation kahit na hindi tapos sa House. But we have to consider reasons of practicality, reasons of expediency, reasons of time is of the essence. Kasi kung mag-antay pa ang Kongreso na isubmit namin ang budget, talagang hindi nila matatapos on time. And that has been the practice since time immemorial, although under the Constitution, the appropriation bill shall emanate from Congress and the Senate can propose only or concur with the amendments once the bill has been approved on third and final reading in the House.
Yes, sir. But my question, sir, to you is that do you think that the president was referring to your faction, the faction in favor of Alan Peter Cayetano, when he said that I will not cite the constitutional provisions that you violated? I'm not talking about who is legal and who is constitutional. I'm talking about who do you think the president was to when he was talking about violations of the Constitution?
Well, I don't know. I do not really know. I can only surmise that the president wants the budget to be approved on time, either on the part of the House, on the part of the Senate. Kaya ang lagi kong sinasabi, we assume that it will be approved. Let us not talk of reenacted budget. Because once we talk about reenacted budget, it raises the presumption or at least the conclusion that it will not be approved on time, which the President cannot afford because ultimately, ang magsasuffer ay yung mga Pilipino because of this pandemic.
So are you saying that the speakership row will not in any way disrupt your schedule in passing the budget on time?
Kasi ang lagi kong sinasabi, mas mabuti na si Speaker Alan Peter Cayetano ang tumapos ng budget deliberation. Kasi siya ang nag-start, pagkatapos siya ang present sa mga budget deliberation, and he should be the one who should also be present during the BICAM. Sapagkat kung magpapalit tayo ng leader at this period of time sa House, and we are discussing the most important legislation in our country, which is the budget of the Philippines, perhaps mahihirapan ang bagong speaker na maayos talaga ang mga provisions sa budget where he did not take that initially during the deliberation.
Kaya nga, sir, yung tanong nga ay nakatulong ba na nag-suspend ng deliberations ngayon bago nag-third and final para siguradong siya. And ngayon na nag-suspend, sir, paano nga kung biglang maging speaker si Congressman Velasco? Paano nyo masisiguro nga na hindi madidelay ang budget?
Well, natapos na namin ang second reading. At alam ng bawat kinatawan, even Lord Alan Velasco, that after the second reading, it will be the period of amendments. Insofar as the gap is concerned, hindi na tayo nagkakaroon dyan ng individual amendments. Because you can just imagine, if 300 congressmen will be standing in the floor or by Zoom, proposing a single amendment and for which he would be given a period of 5 minutes. Kaya traditionally, once the budget has been approved on second reading, a small committee is being created to accept the proposed amendments, and whatever amendments had been approved by the small committee, iraratify naman yan namin sa mga members prior to the third and final reading of the bill.
And so wala nang magagawa. So in short, hindi na yan madi-disrupt ng change of speakership. Is that what you're saying?
That's what
so kahit na si Congressman Velasco.
Yeah. Once we approve the bill on the third and final reading, ipadadala namin yan sa Senado.
Senate, yes.
Senado naman, it is possible, and based on precedent, lagi silang hindi nag-agree sa budget naming ina-approve. In which case,
mag-amend sila.
Budget or points of disagreement, doon naman makakaroon na bicameral conference. Kung yung speaker na upo sa BICAM did not know the antecedent circumstances, paano siya makakapag-represent sa House of Representatives sa BICAM? Kung hindi
kaya
naman
nga, sir, so pwedeng ang bumagal. In other words, pwedeng ang hindi maipasa. Is there a possibility? Kung nagpalit.
The speaker. Pero we can
pwedeng mangyari yun.
Ang garantiya lang namin, Speaker Alan Cayetano knows the budget. Kaya sa BICAM, he would be very competent to discuss. O Senate, wag naman yan ang gawin natin. Binawasan niyo itong COMELEC, may halal lang tayo. Pwede bang dagdagan natin to? O Senate, wag niyo naman bawasan yung DOH, especially the PhilHealth, kasi ito ang kinakailangan ng ating mga kababayan.
Congressman,
That's the problem.
Congressman, anyway, ang tingin pa rin ng Senate and Malacanang mukhang dahil sa early adjournment, madidelay yung at least by 3 weeks daw yung timetable for the passage. Kaya ngayon, merong proposal na kinoconsider daw ng Malacanang for the President to call a special session. Ano yung move nyo pag ganon?
Okay. After the second reading, there will be the period of amendments. Pagkatapos ng amendments, we have to print the bill in each final form and it has to be given to the 300 members of the House. Yung budget natin, it consisted of 4,000 pages. Kaya kahit na nagpatuloy-patuloy kami ng hearing, sa printing alone lamang, which as confirmed by Senator Mig Subiri, talagang matagal ang printing. Kaya talagang impossible na isubmit namin on October 14. And we have to consider that the submission of the budget to the House was delayed by almost 1 month on the ground na ipiprint to ng National Printing Office at nagkaroon ng COVID cases sa National Printing, and that is why they have to suspend the printing. And hindi namin sinabi from the very start, oy, delayed ang submission ng budget ng 1 month. Huwag nyo kami sisihin kung re-enacted budget tayo. We did not say that. We did our very best to finish it on time.
Pero pag nag-special session at tinawag kayo lahat, magsibalik kayo, bibilis yung process. Pag nagtawag...
Well, the process right now, it will be individual amendments. Kaya lahat pwedeng tumayo sa floor o sabihin, oy, Mr. Chairman, I propose an amendment that the project in the city of Das Marinas consisting of the construction of a road involving 10 million be deleted from the budget. And he will
line by line.
5 minutes. Then we will vote. Those who are in favor of the amendment, say nays, say ayes, and that is not practical. Kaya nga sinasabi ko, as of now, tapos na ang second reading, it will be the period of amendment, and insofar as period of amendment is concerned, the practice since time immemorial is to create a small committee.
So, sa tingin nyo ba, sir, hindi ilalaban ang kampo ni Congressman Velasco talaga na mag-take over siya? I mean, are you certain that that's not going to happen? Because that's the only thing that's standing in the way of your plan to meet the deadline, right? That's the only thing naman na pinag-aawayan dito, right?
Well, I am a very realistic politician. And Lord Alan Velasco knows that in order for him to be the speaker, he must have the vote of majority of all the members of the House. And that would be 150. Insofar as the Speaker Alan Cayetano is concerned, we have shown that more than 150 members are supporting him. We have a written manifesto na sinasabi namin, sinusuportahan namin si Alan Peter Cayetano as Speaker. 202 members of Congress signed that written manifesto. Secondly, Alan Peter Cayetano offered his resignation, and it was rejected by 184 members of the House. And these are concrete names na makikita natin. But insofar as the Velasco camp is concerned, they are claiming that they have 160 members right now. Ang tanong lamang ng mga kasamahan ko, meron bang written manifestation yung 160 expressing their support to Lord Alan Velasco? And second, kung wala mang written manifestation, sinabi ba ang mga pangalan ng young 160 congressman who is supporting him? And that is none. So it is
but Congressman, ang tanong naman po doon sa kabila rin is, kung wala rin naman palang kinakatakutan and he has the numbers, then why is he so afraid of a showdown on October 14?
Well, he's not afraid kasi ang sinasabi ko, the speakership can be changed at any time. So, pwede nilang...
Not when there's no session.
What?
Not when suspended ang session.
Yes. But we have periods na hindi naman suspended. Hindi pa kami nagsususpend, sinasabi na nila na meron silang number na 160. So, all they have to do is that, go to Congress, declare the position of Speaker vacant, nominate Lord Alan Velasco, and then calls for a vote. Kahit naman bumalik kami ng November 16, it is always a priority motion to declare the speakership vacant and let us have the vote. Ganun lang naman sa House eh. There is no vested right in the speakership. As long as you don't have the support of the majority, you can be ousted any moment. And everybody knows that, including Speaker Cayetano. Ang request lang ng Speaker Cayetano, hayaan nyo nang tapusin ko muna ang budget up to BICAM. After that, bahala na kayo.
Pag nag-special session, pwedeng magbotohan.
Well, of course, because it is a session. Pero hindi ka naman magtatawag ng botohan unless you have the numbers.
Okay.
Okay.
All right.
Maraming salamat po. Si Cavite 46 Representative Elpidio Barzaga. Sir, thank you for joining us tonight.
Oh, thank you very much.
Salamat po.
Thank you, Congressman. Okay.
Magulo okay.
Dapat tinanong niyo si Secretary de la Peña, baka kaya niya rin doon. Iba, maling subject na naman. Tinanong niyo si Secretary de la Peña.
Araw-araw mas masalimuot.
Pero kasi very telling yung yung binanggit ng Pangulo na constitutional provisions violated eh.
Because the President it wasn't even about a reenacted budget. It wasn't. I mean, the president's point was really about the process. I mean, that seemed to be very, very clear. When he mentions the legality and the constitutionality of what you did, it's really a very basic point where premised on process.
Yeah. But you know how it is in this country, basta hindi mo pinangalanan, pwedeng you can look at it any which way.
Kahit sino yun kahit sino yun, kahit ano yun.
Bida ka pa rin, suli. Okay. Okay, I guess that's all for this Thursday edition of The Chiefs. We hope what to discuss here will keep the conversation going. I'm Adling Gaupan News.
I'm Mami Paminton of the Philippine Star.
I'm Luchi Cruz Valdez of News 5.
I'm Robbie Alampay. We are One News.